me thank you and welcome you. It's terrific to have so many folks here from so many different corners of the community, representing organizations, representing families, representing themselves. So it's great to have you here. I'd like to start and ask you to kind of go along with me a little bit, but I'd like you to reflect for a minute, and if that means close your eyes, don't fall asleep if you were up too late watching election returns. But I would like you to reflect for a minute on two things. One is, if you were to kind of close your eyes and imagine the first thing that comes to mind when somebody says childhood obesity, what comes to your mind? The second thing I'd like to ask you is, why are you here? So over the course of the next 40 minutes, reflect on those two things. What's the first thing that came to your mind when you thought childhood obesity? And secondly, what brought you here today? Why are you here instead of out enjoying this wonderful weather, doing something else? Maybe it's the coffee, could be the bagels, but reflect on that if you would. I'd like to welcome you, euphemistically called Breakfast with Bill. Most people call it Bagels with Bill. But we're here to share some updated information about Pioneering Healthier Communities Evanston, and also to, in the course of the next 40 minutes or so, encourage you to think about your role in our efforts to bring together the community around a shared mission of addressing the childhood obesity epidemic in Evanston. For those of you who can't quite see it in the back, there's a big soda machine being wheeled out of a school, and some kids huffing and puffing and trying to chase their way after the soda machine. A little humor, maybe just a very little humor to start. But this is the challenge we face, and it can be made more significant with the next slide. Throughout our community, throughout our environment, we see very mixed messages. Again, for those who are in the back may not be able to see it, there's a very nice sign that says Health Bar and Eatery, and right below it says Fudge Factory. Over on the left is a very impactful billboard that says childhood obesity, don't take it lightly, right above the My Kind of Shopping Spree at McDonald's. And over on the right, Weight Watchers, right above the Baskin Robbins sign. I guess this is all to suggest that we give very mixed messages. We are experiencing an environment where not only adults but kids get very, very mixed messages about healthy eating, about what they should and shouldn't do, about what's cool and what's not cool. And what we'd like to do today is really focus in on the environment, the policies, and the systems that create a certain outcome in our kids in Evanston. These aren't kids somewhere else. These aren't statistics from somewhere distant that we can point to and say, but that's not Evanston. We're talking about policy, systems, and environment in Evanston that impact our kids in very negative ways. And is there something we, as a community, not as a YMCA alone, not as a health department alone, not as a hospital alone, not as a child care network of Evanston alone, but together can change the outcomes that our systems, policy, environment seem to be creating among kids? So a quick recap of what's going on in national health. Pioneering Healthier Communities. Many of you have heard this before. We'll try to move quickly, but for those who haven't, what is Pioneering Healthier Communities? And specifically, what is it in Evanston? What progress we've made to date. This is a process that began over a year ago when the YMCA applied for a Pioneering Healthier Communities grant. Didn't get the first one, got the second. So starting about May of last year is when we got word that we would be a grant recipient, funding some of what you'll hear about. And most recently, in the last couple of weeks, we got the second round of funding for our effort. Talk about sustainability. I hope that's why some, if not all of you are here, is to help address this issue of having created a bit of momentum. What does it take to sustain that momentum? What does it take to get to the point where we can really begin to see the needle move? And community engagement. Lots of time, I hope, for questions and answers. Let's go to the next slide. So a couple quick definitions. Obesity is defined by one term, is defining a body that has a body mass index of 30 or more, and body mass index, which is not the only, and arguably perhaps not the best measure of obesity, but is one that can be used consistently and can be a measure and can certainly show us trends. While you may argue with it, it will certainly show, if we can move the needle on BMI, can show us a trend that is positive. So that gives you the BMI. These are my favorite slides, but I don't get to do them, do I? Is somebody else going to do these slides? Who? Tim. I yield to Dr. Tim Sanborn, who is one of a number of people in the room today who's been involved in this effort, Pioneering Healthier Communities, Evanston. Dr. Sanborn, I yield to you and my favorite slides.
Thanks very much, Bill. It's a real pleasure to be here, and I will go through some of these slides. The CDC, the Center for Disease Control, has been studying a lot of diseases. You're certainly familiar with immunizations that we apply and use for our children. They have been measuring obesity, as you can see, going back to the 1990s. And what they look at is, what is the percentage of the population, in this case it's with the BMI, obesity index greater than 30. And this goes back to 1990. You can see they didn't have data in all the states. There was a few states that had less than 10% obesity. California, Colorado, some of the western states, New York. There was a number that had an obesity index of 10 to 14%. If you jump ahead now to 2000, you can see we've had to create new categories. We're out of the 10 to 14% rate, and now we're into the 15, and even greater than 20% obesity among adults. And if you jump ahead to another slide, we've created even more categories, so that now, in some cases, you have states with greater than 30% obesity using this definition. The only state of less than 20% obesity is the state of Colorado, where we have a lot of mountain climbers and skiers, people that are quite athletic. Next slide. In 2009, that one state, Colorado, had a prevalence of obesity of less than 20%. 33 states had a prevalence equal to or greater than 25. 1 out of 4 people were rated as obese, and 9 of these states, as you can see listed, had an obesity index of greater than 30%. Next slide. This was a study that was published in the New England Journal of Medicine about 5 years ago, and it looked at population interventions in obesity, and it indicated that unless we start having some of these interventions to reduce obesity in the youth of today, they will live less healthy lives and possibly even shorter lives because of the obesity and how that contributes to hypertension, diabetes, and heart disease. Next slide. Illinois, this is a recent study from the National Survey of Children's Health. 20% of Illinois children are obese, and only Mississippi, Georgia, and Kentucky had more obese children than Illinois. So we were 4th in the nation in childhood obesity. Next slide. These are just some additional data This affects various populations, but perhaps you see obesity more prevalent in Black and Hispanic communities. Next slide. This is true of girls as well as boys. Next slide. So this is the challenge. This is what we're dealing with in pioneering healthy communities, is trying to address this through multiple stakeholders, certainly the physician community, the pediatricians, North Shore Hospital, St. Francis Hospital, the schools, the city of Evanston, and the Department of Health has been very active. And these multiple stakeholders are all trying to really address this problem.
Thank you, Dr. Sanborn.